Heart disease remains a leading cause of morbidity and mortality globally. Understanding the signs and symptoms associated with cardiovascular issues is paramount for early detection and intervention. In this comprehensive guide, we will delve into the 7 serious signs of heart disease that demand immediate attention. By exploring these indicators in depth, we aim to empower individuals to recognize potential risks and seek prompt medical care, ultimately promoting cardiovascular health. Chest discomfort or pain. The first and arguably most recognized symptom of heart disease is chest discomfort or pain. Described as a squeezing sensation, fullness, pressure, or pain in the chest area, these symptoms can extend to the arms, neck, jaw, or back. While the severity and nature of chest pain can vary, any persistent discomfort, particularly during physical exertion or stress, warrants immediate medical attention. This chest pain, known as angina, is often a result of reduced blood flow to the heart muscle, commonly due to coronary artery disease, CAD. It is crucial to differentiate between stable angina, typically triggered by physical activity and relieved by rest, and unstable angina, which can occur at rest and may indicate an impending heart attack. Prompt intervention is essential, as chest pain could be a precursor to a heart attack, where a coronary artery is completely blocked, leading to the death of a portion of the heart muscle. Timely medical care, which may involve medications, lifestyle changes, or medical procedures like angioplasty, can significantly improve outcomes and prevent further complications. Shortness of breath. Unexplained shortness of breath, especially if it occurs during activities that previously posed no challenge, can be a warning sign of heart disease. This symptom suggests that the heart is struggling to pump blood effectively, leading to reduced oxygen delivery to the body's tissues. Shortness of breath can result from conditions such as heart failure, where the heart's pumping capacity is compromised. Fluid may accumulate in the lungs, making breathing difficult. Other potential causes include arrhythmias, which can disrupt the heart's rhythm and impair its ability to pump efficiently. Individuals experiencing sudden and severe shortness of breath, especially when accompanied by other symptoms like chest pain or fatigue, should seek immediate medical attention. Diagnostic tests, such as electrocardiograms, ECGs, and imaging studies, can help identify the underlying cause. Treatment strategies may involve medications, lifestyle modifications, or interventions to address the specific cardiac issue. Fatigue. Excessive fatigue, unrelated to physical exertion or lack of sleep, can be an often overlooked but significant sign of heart disease. The heart's compromised ability to pump blood efficiently can lead to reduced oxygen delivery to muscles and tissues, resulting in persistent tiredness. Fatigue associated with heart disease may be more pronounced during physical activity, as the heart struggles to meet the increased demand for oxygen. However, individuals may also experience general fatigue that persists despite adequate rest. It is essential not to dismiss persistent fatigue and to consult a healthcare professional for a thorough evaluation. Identifying and addressing the underlying cause, whether it be heart failure, coronary artery disease, or another cardiac condition, is crucial for managing symptoms and improving overall quality of life. Irregular heartbeat, arrhythmia. An irregular heartbeat, medically known as arrhythmia, is a potential sign of an underlying issue with the heart's electrical system. The heart's natural pacemaker, the sinoatrial (SA) node, generates electrical impulses that regulate the heart's rhythm. Any disruption in this system can lead to irregular heartbeats. Arrhythmias can manifest as palpitations, fluttering sensations, or a racing heart. While occasional irregular heartbeats may be benign, persistent or recurrent arrhythmias should not be ignored. They can lead to serious complications, including blood clots, stroke, or heart failure. Various factors contribute to arrhythmias, such as age, genetics, heart disease, and certain medications. Diagnosis often involves electrocardiograms, ECGs, Holter monitoring, or other cardiac tests to assess the heart's electrical activity. Management of arrhythmias may include medications, lifestyle modifications, or procedures such as catheter ablation. Individuals experiencing persistent irregular heartbeats should seek prompt medical attention to determine the cause and initiate appropriate treatment. Swelling in the legs, ankles, or feet. Fluid retention leading to swelling in the lower extremities may be indicative of heart failure. In heart failure, the heart is unable to pump blood efficiently, causing fluid to accumulate in various parts of the body, including the legs, ankles, and feet. Edema, or swelling, occurs when the force exerted by the heart to pump blood is weakened. This leads to fluid leakage from blood vessels into surrounding tissues. While heart failure is a common cause of leg swelling, other cardiovascular issues, such as deep vein thrombosis, DVT, can also contribute to edema. If individuals notice persistent and unexplained swelling in their lower extremities, especially if accompanied by other symptoms like shortness of breath or fatigue, seeking medical attention is crucial. Diagnostic tests, including echocardiograms and blood tests, can help determine the underlying cause, guiding appropriate treatment strategies. Dizziness or fainting. Episodes of dizziness or fainting can be alarming signs of heart disease, indicating inadequate blood flow to the brain. Changes in heart rate or rhythm, as seen in arrhythmias, can lead to lightheadedness and, in severe cases, loss of consciousness. Syncope, or fainting, can result from various cardiac issues, including bradycardia, slow heart rate, tachycardia, fast heart rate, or conditions that reduce blood flow to the brain. It is crucial to differentiate between benign vasovagal syncope and syncope due to underlying cardiac issues, as the latter may require immediate intervention. Individuals experiencing recurrent episodes of dizziness or fainting should seek prompt medical evaluation. Diagnostic tests, such as tilt table tests, electrocardiograms, and ambulatory monitoring, can aid in identifying the cause. Treatment may involve medications, pacemakers, or other interventions depending on the underlying cardiac issue. Persistent cough or wheezing. A chronic cough or wheezing that doesn't improve with standard treatments may be a sign of heart failure. In heart failure, fluid accumulation in the lungs, known as pulmonary edema, can lead to respiratory symptoms. As the heart struggles to pump efficiently, blood backs up into the lungs, causing fluid to leak into the airways. This can result in a persistent cough, wheezing, or difficulty breathing. While respiratory conditions like asthma or chronic obstructive pulmonary disease, COPD, may also cause these symptoms, it is essential to consider the possibility of heart-related causes. Individuals experiencing persistent respiratory symptoms, especially if accompanied by other signs of heart disease, should seek medical evaluation. Chest X-rays, echocardiograms, and pulmonary function tests may be employed to diagnose and differentiate between cardiac and respiratory causes. Treatment may involve medications, lifestyle changes, or interventions to address the underlying cardiac issue. Conclusion: recognizing and responding to the 7 serious signs of heart disease is paramount for preserving cardiovascular health and preventing life-threatening complications. Chest discomfort or pain, shortness of breath, fatigue, irregular heartbeats, swelling in the legs, dizziness or fainting, and persistent cough or wheezing should not be dismissed. Early detection through thorough medical evaluation, including diagnostic tests and imaging studies, can facilitate timely intervention and improve outcomes. Individuals experiencing these symptoms should prioritize seeking professional medical advice. Cardiovascular health is a cornerstone of overall well-being, and proactive management of heart disease risk factors, coupled with prompt attention to warning signs, is essential for maintaining a healthy heart and a fulfilling life.